Have you ever felt like you were navigating the world with a different set of instructions, like everyone else instinctively understood a language you were never taught? For many adults with undiagnosed autism, this feeling of being lost in translation is a constant reality. They experience the world intensely, often overwhelmed by sensory input, or struggling to decipher social cues that seem obvious to others. This sense of being different, of not quite fitting in, can be profoundly isolating. Yet many individuals with undiagnosed autism remain unaware of the reason behind their struggles. They may attribute their difficulties to personality flaws, anxiety, or simply feeling different. But beneath the surface lies a neurodevelopmental difference that profoundly shapes their experiences: autism spectrum disorder. Autism spectrum disorder, ASD, is often associated with childhood. We picture children with difficulty speaking or making eye contact. While these signs are crucial for early diagnosis and intervention, they don't represent the full spectrum of autistic experiences, especially in adults. Autism is a lifelong condition. It affects how individuals perceive the world and interact with others. Adults with undiagnosed autism may have developed coping mechanisms over the years, making their challenges less obvious. However, the underlying neurological differences remain, impacting their social interactions, communication styles, and sensory sensitivities. To navigate a world that often feels overwhelming and confusing, many adults with undiagnosed autism develop sophisticated coping mechanisms. They learn to mimic social behaviors, suppress their natural responses, and mask their autistic traits. This constant effort to fit in can come at a significant cost. Masking can lead to exhaustion, anxiety, and depression. The effort to appear normal drains their energy and prevents them from truly being themselves. It's like performing a demanding role day in and day out, leaving them feeling depleted and misunderstood. For years, I thought I was just awkward and socially inept, shares Sarah, a 35-year-old graphic designer diagnosed with autism as an adult. I had no idea that my struggles with sensory overload, social anxiety, and difficulty reading between the lines were all connected to autism. John, a 42-year-old accountant, echoes this sentiment. I always felt like an outsider, like I was missing some crucial social rulebook that everyone else seemed to have received at birth. His story, like Sarah's, highlights the profound sense of isolation and confusion that many adults with undiagnosed autism experience. Navigating the workplace maze. Autism and professional challenges. The workplace presents unique challenges for individuals with undiagnosed autism. The emphasis on social interaction, unspoken rules, and navigating office politics can be a minefield of misunderstandings. Individuals with autism may excel at tasks requiring focus, attention to detail, and pattern recognition. However, they may struggle with the social aspects of work, such as understanding office dynamics, interpreting subtle cues, or engaging in small talk. This can lead to misinterpretations, conflicts, and missed opportunities for career advancement. Family ties. Unraveling the impact on relationships. Within families, undiagnosed autism can lead to strained relationships and communication breakdowns. Loved ones may misinterpret autistic traits as aloofness, lack of empathy, or even rudeness. The individual with autism may struggle to express their emotions and needs effectively, leading to frustration and misunderstandings. Open communication, education about autism, and seeking professional guidance can help bridge these gaps and foster stronger, more supportive relationships. A light in the dark. The power of diagnosis. While the challenges of undiagnosed autism are significant, there is hope. Receiving a diagnosis as an adult can be life-changing. It provides validation, a sense of relief, and a framework for understanding their experiences. Diagnosis opens doors to support groups, therapies, and resources tailored to the needs of autistic adults. It empowers individuals to advocate for themselves, educate others, and create a life that aligns with their strengths and aspirations. Embracing neurodiversity, a call for understanding and support. Understanding and accepting neurodiversity is crucial. Autism is not a disease to be cured, but a different way of experiencing the world. By embracing neurodiversity, we create a more inclusive and compassionate society where individuals with autism can thrive. We need to move beyond stereotypes and recognize the unique strengths, talents, and perspectives that autistic individuals bring to our communities. The journey to self-compassion, a message of hope. To those who resonate with these experiences, remember this: you are not broken, you are not alone. Your struggles are valid, and seeking help is a sign of strength, not weakness. Embrace your unique neurology, celebrate your strengths, and never give up on the journey of self-discovery and self-compassion.